My name is Dr. Harpel Bains. For this topic, I'd like to talk a little bit more about how to increase compliance when taking LDN, especially when the side effects just seem a bit too much. So, this topic is, I would say, relevant to those patients, for those who are listening in. If you are one of those, you're really keen on starting on LDN, but you've heard all these horror stories about the side effects, this would be quite an important lecture for you to listen into. To give you a bit of context about the side effects of understanding it a little bit more, and also to at least feel a little bit more in charge of how you can address these side effects, even if your practitioner doesn't have the necessary level of experience. And that can happen. There are a lot of practitioners who have only recently heard about LDN and they may not have the relevant level of experience. Sure, this topic would be quite useful to take it to the next level of getting a much better understanding of what to expect. Why are these side effects happening? And I think that's quite a big one, because when you don't know why, it's pretty scary. Also, what you can do about it. If you think about how LDN really, what it really does in your body, it's quite simple. All it really does is that it blocks these receptors in your brain, and by blocking these receptors in your brain, it tricks your body into thinking that it doesn't have enough of endorphins anymore. And therefore, what the body then does is it tricks your body into making more endorphins. That's it. LDN is as simple as that. It tricks your body into making more endorphins. And every action that you have for LDN is the action of endorphins and not really the LDN, which is one reason why it's able to work on so many different diseases and so many different types of symptoms. Seems a bit like a magic drug sometimes. This topic would be quite useful to take it to the next level of getting a much better understanding of what to expect. Why are these side effects happening? And I think that's quite a big one, because when you don't know why, it's pretty scary. Also, what you can do about it.